My name is Orlaith. I work for King Animal Hospital and I specialise in equine surgery. So one of the benefits of a standing CT is exactly that, is a standing procedure. It's weight bearing, especially if we're doing distal limbs. We can see the horse in its weight bearing state, which can give us a lot of information about the joint and bone facets, especially the joints, and especially in racehorses. So the weight bearing phase and also standing, which means that the horse just receives standing sedation, means that the horse does not have to undergo a general anesthesia for us to acquire the images that we need to evaluate the bone and joint structures in the legs. That's one advantage. And then when we want to look at the anatomy of the sinuses and the head and dentition of the horse, one of the advantages is we don't have to drop the horse under a general anesthetic to look at those facets either. We can actually do everything in a standing procedure. Before CT, in recent years, we have become very proficient with ultrasound and radiographic studies, but radiographic studies are usually 2D, and the advantage of CT is that it is 3D, and we can look at horses' limbs and the skulls in a 3D fashion. So frontal, sagittal and transverse planes, which will allow us to basically crisscross through the anatomy and look at minute details, whereas previously those were overlapped in radiographs, and ultrasound wouldn't always let us get through a bony interface. So ultrasound was very beneficial for soft tissues, but CT does cross-sectional imaging, which is hugely more detailed and gives us the information that we need in very complicated anatomical structures such as the sinuses, the dentition, and the distal limb, where we can cross-sectionally view the limb and look at areas that we can't see as easily on radiographic studies. It's about managing the horse, whether it be a rehabilitation type management or potentially a surgery if that's what we think is appropriate. So sometimes a surgery might involve a placement of a screw if a CT shows a linear line and confirms the presence of a line that could be compressed with a lag screw. So those are surgeries that are planned, and that's what CT allows, is surgical planning for elective type surgeries and also for emergencies if that becomes a problem. So if you have an emergency case where a fracture is traveling up through the bone, a CT would actually allow you to plan for a surgical correction of that problem, because it allows you to actually follow the line and see where exactly it's going. Whereas on radiographs, sometimes we're guessing.